Hello, my name's Mark Parsons. I'm the Assistant Director of Capital Planning for Swansea Bay University Health Board. Looking at the options that we were aware of, we obviously aware of the capital solution. We were aware of other solutions such as lease, not used as much within the NHS, to my knowledge. And again, for me, working with ModuleCo and looking at the options, it was definitely the right route to go down, and I would recommend that all NHS organisations look at this option going forward to see which one is best suitable to them at that time and the finance streams that they have available to them. One of the advantages of going down the modular route is using modern methods of construction, but it's also, because it's being built in a factory, you can actually go and look at it at the various stages and you can see the quality process that ModuleCo use. It also gives you the advantage of taking along, which we did, our nursing staff, our consultants, our authorised persons for the various areas, and even our authorised engineers that we use through a shared service. And again, seeing that in the quality process was just excellent. And when you're in the building, you wouldn't even know you're in a modular theatre. The major advantage was bringing people in, because we don't normally get to bring them in until construction is at this latter point. Being able to bring people in while it's being built and looking at the various stages was really advantageous, including our authorised persons, our authorised engineers, and key stakeholders like consultants, nurses and other staff was a major advantage, and ModuleCo offering that facility was superb. Obviously, having an additional 3 theatres has enabled us to work on our backlog. It's provided a facility that is very good quality. The comments we get on it is excellent, and staff feel comfortable working in there. And again, if you've got a comfortable and safe environment, it means that you are providing excellent care. The Health Board has looked at traditional builds. We decided on modular build for a number of reasons. ModuleCo offering the capital and revenue solution, but one of the key reasons for going with the modular unit is, one, it could be built off-site, so obviously less activity on site, so less likely to have any safety incidents, and at the end of the day it was delivered it far quicker than what we could have through the traditional build route. So with the Health Board and ModuleCo working closely together with all the stakeholders, by going down the modular route, it meant that we had it delivered, all fully compliant, all up and running, far quicker than what we would through a traditional build, which then enables us to then make an inroad into our backlog and obviously improve patient outcomes of care. Well, staff and patients, have provided excellent feedback because it's an excellent facility. Staff like working in it. You've got plenty of space in it. The staff changing areas and breakout areas are far more spacious than what they have in our other hospitals. So it's been really beneficial, and again, it's been able to comply to the most recent regulations as well. Throughout this project, the engagement with ModuleCo has been excellent, and with their experience of modular units, they were able to bring that expertise. So we've learned a lot through this process as well as them. So that collaborative working is excellent, and again, I would look forward to working with ModuleCo in the future. It was great to see that the project was delivered ahead of schedule, and I think the basis of that is the close working with ModuleCo, the close working with all our stakeholders and them having full engagement, and this include discussions with ModuleCo, visits to site, and I think all that collaboration has enabled the project to be delivered far ahead of time, and therefore making a positive step in the outcomes of our patients. Working closely with ModuleCo, obviously with the modular experts, which we were putting these modular units next to our current traditional build hospital. We had to put corridors in place to adjoin the two facilities, and again ensuring that safety was paramount, working closely with ModuleCo ourselves, everybody on site, our PFI partners, ensured that appropriate risk assessment method statements and any other aspects that needed to be addressed were addressed. And again, if we look at the craning process of when they brought the modular units in, it was fantastic to watch, and it was all done in a sequenced and safe manner. Reflecting back on the whole project, from start to finish, would I use ModuleCo again? 100% I'd use them again. Would I recommend them again? Yes, I would. And the reasons I would is because of their openness to discussion, their openness to debate, their openness to tell us what projects have worked elsewhere and why, and taking on the learning not only from ourselves but other projects. So they are the main reasons why I would work with ModuleCo again.